Okay, let's go ahead and get started. So a big welcome to everybody. We're so glad to see you here. Hope you have been enjoying the other presentations this morning. As I said, we're going to talk a little bit right now about the COVID procedures that we've been taking over the last 10 months. And those are to mitigate the risks as much as we can for both passengers and the volunteers. And as I said, we'll be taking your questions at the end of the presentation. You can put them in the chat at the bottom of the screen again, or raise your hand. That function is located under participants at the bottom of your screen. And there you should see the raise hand function at the bottom of your white participant screen. Before we get started, just here's a couple of photos of the many relief photos that we have done, again, over the last 10 months to get relief supplies to people. These are our Angel Flight West COVID-19 guidelines, and I will read them to you, give you a little bit of background on all of those. So the COVID-19 guidelines that we're currently using, and we always suggest that you check the CDC website for any up-to-date information that might be there. All passengers and volunteers and drivers are required to wear masks. That means when you're in the airplane, when you're on the tarmac, when you're in a car, in the FBOs, anywhere, we want you to do that. Those who have any symptoms of COVID-19 or have been exposed should not fly. Again, the CDC link is where you can find out where those symptoms are if you aren't already aware of that. And they also have the most up-to-date symptoms, as they do change occasionally. On the day of the mission, we do ask that all passengers and volunteers try to take their temperature. We have run into some passengers who don't have a thermometer. I spoke to one yesterday, actually. But anybody who does and presents with a fever should not travel, even if that person says they're feeling well or they know they don't have COVID. If they've got a fever, we absolutely would not let them travel. We ask that physical distancing be observed whenever possible. Everybody kind of knows what that is by now. You know you can't keep that exactly once you're inside a 4-seat aircraft or inside of a vehicle, but we ask you to do your best, keep everybody as far apart as possible. We also ask that passengers obtain permission from their volunteers before eating or drinking in the aircraft or the car. You know, we tell passengers, many of them do need to drink water to keep hydrated, especially if you're on a longer flight in the summertime, it's hot. And there might be some passengers who need to eat because of their medical condition, or they haven't had a chance to get breakfast or lunch while they're at their treatment. So we do ask that you get permission, since they'd have to take off their mask a little bit to do that. Want to keep that to the absolute minimum. All of these COVID guidelines and everything that we're going to talk about today were arrived at through the organization. Josh talked about it yesterday, but for the first about month or so when COVID hit, we continued to fly missions. At that point, we sort of hit the pause button. And when we did, a group of very smart people, much smarter than me, I'd have to say, Hunter Hanfield, Rich Pickett, other medical professionals, some of our healthcare providers, Josh and members of our board got together and did their best to come up with all of the guidelines that they think we could use to go back to flying safely. And once we did that, that was about just about early June. We started going, and that's when we implemented all of these guidelines. As a command pilot or an Earth Angel, you'll find all of these reminders throughout every written communication you get from Angel Flight West through the VPOID system. So the reminder is at the top, always with the reminder to make sure you follow all the guidelines, and that those emails also have a link to our knowledge base and to the CDC guidelines. I saw out of the corner of my eye there, somebody asked in the chat if they could get the link for disinfecting a car and airplane. There is a whole page of resources on the Angel Flight West knowledge base, and Isabel will put this link in the chat for you. You can always go to that knowledge base and just look for any topic you're looking for. So in this case, COVID-19, or you could put waiver of liability, or anything that you might want to know about Angel Flight would be there for you. When a new passenger makes a request for a flight, or when a passenger who hasn't flown since COVID calls us for a return flight, one of the first things that the coordinator or ops team will do is go over all of the policies with them. So everything that I just read to you about wearing the mask and fever and all of those things, we go over all of that verbally with the passenger and make sure that they are willing to abide by those. And just as with our volunteers, we provide those reminders on many of the written communications that go out to our passengers. So just as you get that mission itinerary form from us once you've signed up for a mission as an Earth Angel or a pilot, the passengers get a copy of that as well. Those guidelines are there. They get some automated reminders from us about baggage weight and the day of their flight and other things, and that reminder is at the top of that as well. Reminder about photos. Right now, we always want everybody wearing their mask for safety. That's the most important thing. But additionally, please know if you send us photos of a mission and you're not wearing a mask, we won't be able to use that photo for any of our newsletters, social media, anything else. And additionally, you'll probably get a call or an email from me suggesting and reminding you that that needs to be done at all times. If for any reason you have a passenger who is not compliant, and in the 10 months that we've been doing this, I only am aware of one passenger, please let us know. We will reach out to that person and talk to them and let them know that if they don't want to follow our guidelines about masks, that we would not be the appropriate resource for them. Couple more photos of passengers throughout the COVID time. Here's just a few of the COVID relief stats. They don't really have to do with our policy, but I thought this would be interesting for everybody. Since about middle of April or so, we have flown 502 COVID relief flights, moving 40 tons of PPE, family household items that includes water, diapers, adult diapers, disinfectant, pretty much anything you could think of. In Arizona and Northern California, we actually flew tons, literally tons of fresh produce, some to the Native Americans down in the Pacific Northwest, and then up in Northern California to some communities that were really struggling. In addition to that, we booked tickets for 215 frontline health care workers traveling to those medical facilities that had a high need for extra assistance. A good chunk of that was done through our partner, Alaska Airlines, and then we also got some flights, quite a few flights from Southwest Airlines. I have to tell you, those people were so grateful for the assistance. They enabled them to get to where they needed to go to help, especially early on when things were so bad on the East Coast. Many of you have asked several questions about vaccines, about the possible delivery of vaccine to more remote areas, and we have done some outreach for that. Currently, we don't have any imminent opportunities. We are in some discussions with Team Rubicon about possibly doing that, but nothing is coming right now. Please know that as soon as that happens, the command pilots will be the first to hear about it. Hopefully we can get some of those going. And then additionally, some of you have asked whether we have the ability to help you get the vaccine early as a person who is providing transportation for medical treatment. We're working on this through a variety of channels. We did get an opportunity at Children's Hospital in Seattle a couple of weeks ago. About 70 pilots received their first dose of the Moderna vaccine. That came through the efforts of our board member, Jeff Ogeman, who's a surgeon-in-chief and senior vice president at Seattle Children's. We thank him for that. An opportunity has just come up in Colorado, and that email will be going out to the Colorado Wing members soon, giving them an opportunity to get the vaccine. Jeff Ogeman is also sending out letters to his colleagues across the Western region, and hopefully some more opportunities will come up from that. Additionally, some of you may have heard that there are some people that have been able to walk into a vaccine clinic and present their Angel Flight ID or badge or something that identifies them as an Angel Flight pilot, and they've been able to get the vaccine. That is hit or miss. That's not happening anywhere. Let us know if you want some help with that, and we'll see what we can do. Just a list of a few of our relief partners that we have worked with over the last 10 months. Of course, our partners again at Alaska and Southwest Airlines. Project Cure, we have provided plane loads of PPE to hospitals in Arizona and Colorado through Project Cure. More PPE in Colorado through the Colorado Hospital Association. That was a relationship that was fostered by Benjamin Anderson, the Vice President of Rural Health and Hospitals at CHA, who's now on our board of directors. And with Love from Strangers, which is where we did a good bulk of our flying. It's a grassroots nonprofit started by a doctor in Salt Lake City. And that grew and grew and produced massive airloads of PPE and relief supplies to the Navajo, Apache, Zuni, and other nations in the Southwest. For any of you that might have flown those missions, I'm sure you'll be tickled to hear that Christy is now working on her pilot license. This endeavor made her want to become a pilot. She is going back to work in April, and she's attempting to get her private before then, so she's working hard at that. So I just wanted to show, especially in this young lady here, it's amazing how you can see the smiles right above the mask. So even with the mask, we can get photos where there are smiles. We're going to close with a little video that Project Cure put together for us, and then we'll be happy to take your questions.
Hi, this is Douglas Jackson at Project Cure, and I'm just coming to say thank you to all of the team at Angels Flight. You know, you gave your time, the use of your aircraft, the fuel, so that together we could provide our healthcare heroes in the rural communities with all the things that they needed. It's together with this partnership that we're taking care of our communities, and we want to tell you thank you for what you did.
Okay, I hope everybody enjoyed that. Alejandro, I am going to call upon you because I am not sure why this happened, but I appear to have lost my Q&A screen. Alejandro, you have yours handy?
You know, I do not either. I do have the chat screen only.
So we don't have Q&A because this is.
I'm sorry. No wonder I couldn't find it. Okay, I'm so sorry, guys. We're fumbling through a few of this. So let's start with the questions in the chat. I'll start up at the top. Beth, you should have received the link there in the side there to our knowledge base, and there's an article there about disinfecting your aircraft. Jason, if passengers say they haven't had their temperature taken, are you okay to bring your own thermometer to take their temperature or not? Yeah, I would suggest that you only do that if you have one of the no-touch thermometers, the kind you hold up to their forehead, and not the kind that you use orally. But yes, and those are available pretty inexpensively online. You can get them for $25, maybe even less in some cases. Rich answered that question on the chat. Rich has added a link to those documents, and I think it's also in the link that Isabel put in for you earlier. And Ray, I think the question about the vaccine for spouses, unfortunately, at this time, most of the facilities that we're working with are only providing that for the command pilots, unless that spouse is an Angel Flight volunteer who is flying missions as a regular mission assistant. But otherwise, they're limiting to those who are doing the missions. Curious on Hunter's feelings about pilots between first and second COVID jab. That's such a marked question. This is going to become more and more a situation. What are your thoughts on that? Hunter, would you be able to answer that?
Sure, happy to. Apologies that I came on late. I guess I assumed this wasn't going to start until the previous mission orientation stuff was done, so I came on late. The only thing, and I don't know what you covered. The only thing I would want to say is that, in a little bit of contrast to the documents that were written several months ago, the data in favor of airborne transmission are becoming stronger than they were at the time. So you do need to take precautions on the assumption of airborne aerosol transmission and not simply droplets. To some extent, I think that's becoming moot as immunization becomes what should be the primary defense. The data that are evolving suggests that although the current vaccines were all studied with the main endpoint to be what disease, prevention of disease, of illness, as opposed to infection without symptoms. The evolving data are that they are quite effective, if not quite as effective, against preventing infection as well as disease. Second, there is substantial prevention and protection after the first dose. It could be as high as 90% after the Pfizer and Moderna vaccines. We'll have to see about Novavax, AstraZeneca, and Johnson & Johnson as they come along. But more likely than not, for example, a potential passenger who has been immunized and is more than 2 weeks out after dose number 1 is not officially immune, but they are less likely to be susceptible, substantially less likely than otherwise. Same is true of pilots. Whether you want to take advantage of that and actually push the envelope and consider yourself immune early doesn't meet any official recommendations, but it probably is valid most of the time.
Great, thank you, Hunter. Do we have any other questions?
Cheri, we had one yesterday that Rich could respond to. I don't know if that person is on here, but about having trouble communicating with a mask. He noticed that the controllers were having trouble communicating and wanted some recommendations on techniques or types of masks to make that better.
Thank you, Josh. I think I did see, oh, there is Rich. I see him right there.
Hi.
Hi.
Yeah, in fact, I was just going to write back to Ray. I think he was one of the people who posed that question. I wear a mask all the time in the cockpit and all different aircraft. And so I'll put the mic, I wear an N95 in the aircraft, really close to the outside of the mask, and it seems to work fine. It's rare I have any problem. ATC has never asked me to repeat anything. Sometimes with people on the intercom, if they have a little bit of problem, I'll put it inside the mask and then just try to make sure that the mask seals. But with the N95s, they seal pretty well even against the boom, like on the A20s in here, because if I bring it in here, it's a real small gap. But if I think that there's any issue, as I mentioned, the first thing I do is just push it closer to the fabric of the mask.
Great, thank you.
You're welcome.
Hunter, another question for you, and thanks, Rich from Ray. Can a vaccinated person transmit the disease?
Again, this is data, official data, and final analyses will be evolving over time. But the answer is probably yes. I think one of the corollaries to what I just said about symptomatic versus asymptomatic infection is that if there is protection against, number one, if there's partial protection, perhaps a high degree of protection against infection as opposed to disease, then those people by definition will not have the virus. Second, the protection against disease probably occurs in part because the vaccine enhances the immune response so as to reduce the viral load. So, and the lower the viral load in the respiratory passages, the less likely transmission is going to occur. So will it reduce the transmission risk? Almost undoubtedly, yes. Will it totally prevent the risk in all circumstances? Not known, probably not. And those are the reasons that for midterm future, next 2 to 6 months, whatever it turns out to be, masking and social distancing are going to continue to be important and the norm and widely recommended even among vaccinated people and populations. The extent to which we will become tolerant of that and a little flexible will play out probably socially as well as in terms of scientific recommendations. But you should continue to assume for now that there is at least some potential for transmission by vaccinated people.
Thank you much.
But it's probably low.
A comment here from Stuart, and I agree with that, Stuart. I believe it's also in the guidelines or the white paper that Josh wrote, or from all of the data that was suggested, that make every attempt to maximize the airflow in both the aircraft and automobiles. And I think that was something that was suggested from the very beginning.
If there are any other physicians who are in on this, please feel free to comment. You know, well, let's just say I don't have a special monopoly on. I'm an infectious disease and public health expert, but nowadays an awful lot of people without that training are equally valid experts in this disease.
Thanks, Hunter. As Josh mentioned yesterday, your counsel has been invaluable to us over the last 10 months. So thank you so much for that.
It's been a pleasure.
Hey, Hunter, just real quick. I just, and I've got to go to my other session. This is Rich. I just read a paper today of where they analyzed COVID survivors who had gotten that first dose. And it was interesting because they thought that they reached an incredibly high level.
Well, and that same report seems to indicate that they have a higher chance of having rather vigorous immune reactivity to that immunization. People have had COVID and get immunized. It is exceedingly pertinent to me because, as it turns out, my wife was diagnosed a couple of weeks ago. As we sorted out the timing and when she might have been exposed and how, perhaps on commercial travel from Hawaii to Seattle in early January, it would seem that she got the Moderna vaccine, and within hours got horrible headache and loss of appetite. The next day she got fever. She got 4 or 5 days. She got tested in there, was positive. But in retrospect, what we think is that she had been infected 3 weeks previously, was getting better, never had any respiratory symptoms, and now had hyperreactivity to the vaccine. So it's hard sometimes to tell, but it's something to keep in mind for those of you, such as some of you who I know are on this screen, have had the infection and now will be getting and may have had the vaccine. If anybody's had a personal experience like my wife's, feel free to speak up.
Yeah, I had a heightened response to the Moderna virus. So for about 3 days.
Moderna vaccine, yeah.
Yeah, I mean to the vaccine. Yeah. So
you had heightened reaction to the virus as well. So
that's true. Yeah. My arm hurt for about 4 or 5 days. Jane got Pfizer and said it didn't bother her at all. I said thanks. So.
By the way, for those of you that don't know, there may be some new people on, and Rich, you do have your next one coming up, but I'll just say Rich is a COVID survivor. He was on a ventilator for 11 days.
Yeah, 11 days.
11 days. So we're certainly glad to have him around. I think we're nearing the end of our time. However, I know that Hunter, Isabel, we don't have any crossover, correct?
No,
This can run long, yeah. So I know that Hunter, if you've got an extra few minutes, if anybody has any other questions for you, are you able to stick on and answer a few?
Yep. I can hang around, and anything beyond that, emails are just fine if you have any questions for me. I have a very simple email address. I'll put it in the chat, but it's just HHH in the University of Washington system. So hhh@uw.edu.
Yeah,
We can
so,
put that in the chat. And I'll just say real quick too, because this has come up a few times. Even as we're working with healthcare facilities to get those vaccines and our volunteers scheduled, if in your area, a letter from us would help on our letterhead. We do have a draft of that we created with Dr. Ogeman, so we can make that available too at the end of the day today and send that out to anyone interested. So just please let us know.
great. If that is everything, thank you so much. Rich is doing some safety sessions coming right up now. There's one at 3 and one, I believe, at 4. So please go back to that homepage, click on one of those links and join the informative safety sessions. Thank you all for joining us.
Thank you.
Bye-bye.